Hi there, good morning and salam. My name is Dr. S. Energy Rahman. This is a series of video blogs we are doing to create breast awareness programs and to create hernia awareness programs. We have several videos regarding the breast awareness programs. Today I'm going to talk about the hernia awareness program. See, the hernia. Hernia is a disease which can only be treated by surgery, by an operation. May this operation be an open operation, which was conventionally done or had been done for many years, many decades, or it can be a laparoscopic repair, which is done by a camera. Laparoscopically also, as I said in one of my blogs, there are two kinds of hernia repairs. One is for groin hernias, it can be TAPP tap or TEP tap. We as a team are doing tap. Tap has a long learning curve. It is more difficult to do. Once you are trained, it is much more comfortable for the patient. Why? Because you don't fix the mesh. When you do a TEP tap, you don't fix the mesh. Post-operatively, between TAPP tap and TEP tap, in TEP tap, the patient has less post-operative pain or almost negligible post-operative pain and almost no chances of recurrence. The hernia coming back is very rare or less. Patient is able to go home early. Also, the ventral hernias like paraumbilical around the umbilicus, paraumbilical epigastric hernias, they are done laparoscopically. If you listen to one of my other blogs, we actually were trying to tell you the concept of a boat. You can listen to that. The concept is that if you do a laparoscopic repair of a hernia, and if it is done properly, chances of coming back of the hernia or recurrence are very less. In the open operation, yes. If you are not trained, you can do it. Or if it is a patient's choice, he doesn't want, but there is a cost of bearing. But then in open hernia, the chances of recurrence of the hernia coming back are more. In this blog, we are going to talk about the complications of hernia. Once you have a hernia, you're going to have it. It's not going to go back. It might go into the tummy, come out, as there are factors like constipation, like coughing, these things. When you're straining, when you're lifting weights, it might have gone back into the tummy, but it can come again. So it's coming in, coming out, coming in, coming out. But that's not treatment of hernia. The hernia is there. So once you have a hernia, identify that you have a disease. This is important. You must appreciate that you have a problem. And it is awareness of this problem that will take you to the doctor. Wearing some kinds of belts on the tummy or the groin, they don't work. They actually make the hernia worse. For example, you are wearing a belt for 5 years. Then after 5 years of development of a hernia or occurrence of a hernia, you go to the doctor, then the repair will be difficult. And also the chances of hernia coming back are more. So hernia can present at birth, it can present in childhood, or it can present in the adult life. Once you have a hernia, you have it. There is no escape from it. Initially, the intestine is coming out of that opening in the hernia, causing a swelling anywhere around the tummy, in the groin or in the front part of the tummy. Then it's going back. So this is kind of a satisfaction that I have a problem which comes out and goes back, comes on, goes back. But with passage of time, this hernia which is coming out and going back, which is called as reducible, becomes irreducible. Now the bag of hernia which has the intestine becomes so much overcrowded that the hernia or the intestine is not able to go back. So it stays there. Now you have a swelling which is not going back. It is there. This is called as irreducible hernia. Up till here it is fine. But actually you should have operated. You should have had yourself operated, had yourself surgery done when it was in the initial stage, the reducible stage. Okay, fine. So sometimes what happens is that the blood supply, after this overcrowding of the intestines and called as irreducible hernia, which is not going back, the blood supply of the intestine becomes compromised or becomes obstructed. Now what happens? This intestine, which was a living thing, which was viable, this becomes dead. It's called as gangrene. So once a gangrene occurs, it causes a lot of pain, causes vomiting and things like that, fever. It causes a lot of pain. Now a problem which was of small magnitude, very small problem, which could have been operated in half an hour or 45 minutes, now become a bigger problem. Why? Because you are not able to appreciate or talk to yourself. You have a problem. You should be aware. Now I have a problem. There is no escape. There is no denial. Why this gangrene happened? Because you were not able to appreciate that you have a problem, or if you appreciated, you ignored it. This can happen. But the message here is, once you have a hernia, it's in the early stage. Before it becomes a gangrenous or a dead part of the intestine, you must get it operated. Once the gangrene occurs, then you have to make a larger incision in the tummy. Reduce the hernia, cut the intestine, rejoin it again. So it's a stay of operation which was for 1 day only, now becomes 7 to 10 days with lots of other problems. So my message today in this video blog is, if you have a hernia, yes, you have a hernia. There is no escape. But you must consult a doctor, a surgeon who is trained. Whether you want an open operation is fine. Whether you want a laparoscopic is fine. But the important thing is, do something. Get it done. Go to a doctor. Don't ignore the problem. The problem will persist and it's going to become bigger and bigger and bigger. What we do, like around 15 years ago, we started putting mesh. Mesh is a special kind of a piece of, there are different kinds of meshes. They're made of different kind of materials. Some are more body friendly, some are less body friendly. But naturally, the cost is one thing which should be borne in mind. But for a simple mesh, very basic mesh, which we started I think 15 years ago in Pakistan, and we have been doing all kinds of mesh repairs abroad. There are now very advanced kind of mesh systems, and our team has used all of those mesh systems. For venter hernias, for groin hernias, there are self-adhesive meshes, there are taggerless meshes, there are ST systems. I mean, you name it and you have it. And the technology is going further and further and further. So if you have a hernia and you happen to go to a doctor, ask them, you want a mesh to be placed. The choice of mesh, the type of mesh, and the type of surgery, whether open or laparoscopic, will be decided between the doctor and the patient. But one thing is for sure, the mesh has to be placed. So my message today is, if you have a hernia, you can have complications. It's not good to have complications because the cost, time of stay in the hospital, and the problems which you face after the operation are more. So if you have a hernia, appreciate it. You have a problem. Don't run away from it. Get it operated. That's the message for today. Thank you very much.